Kind of classic trio of symptoms that are often the first clue. Number one is that abdominal bloating and distension,
Mm,
that feeling of being puffed up, often getting noticeably worse after eating, especially carbs, because the bacteria just love fermenting them.
right, the dreaded post-meal bloat.
Exactly. Second is often diarrhea. This happens partly because the gas produced by fermentation, but also because the bacteria can mess with bile salts, which affects how you absorb fat. And third, particularly if it's been going on a while or is quite severe, you can see malabsorption and weight loss because the body just isn't getting the nutrients it needs from food.
Okay, those are the big three. But what other gut symptoms might show up?
Yeah, lots of other common GI stuff. Things like ongoing abdominal pain or cramping. Sometimes it's vague, sometimes more localized. Uh, Lots of gas and belching, flatulence. Nausea is pretty common too.
Right.
And in cases where fat absorption is really hit hard, people might notice styria stools that are fatty, pale, really foul-smelling, and tend to float. That's a clear sign of fat malabsorption.
Now, here's something that might seem counterintuitive. We usually think diarrhea, but the research highlighted that constipation can also be a major symptom, right? Specifically with a certain type.
Yes, absolutely. That's a key point. Chronic constipation is strongly associated with methane-dominant Sibo. In fact, the terminology is shifting a bit now, and it's often called intestinal methanogen overgrowth, or IMO, to reflect that it's methane-producing archaea, not strictly bacteria, causing the issue and slowing things down.
IMO, okay. So it can go either way too fast or too slow.
Precisely. And this is where SIBO really shows its reach beyond the gut. Those systemic symptoms, they often stem from the chronic malabsorption and the low-grade inflammation it causes. So you see things like profound fatigue and weakness, the kind that sleep doesn't fix. You see specific nutritional deficiencies cropping up: iron deficiency, anemia, low B12, low vitamin D, AE.
Which can cause their own set of problems.
Absolutely. Neurological issues from B12 deficiency, bone problems from low D, skin issues. We also see joint pain, sometimes seemingly random skin rashes like that rosacea connection we mentioned. And then there's that really frustrating brain fog, difficulty concentrating, memory issues. It often floors people how much their gut health seems to be affecting their mental clarity.